morning, good afternoon, and good evening, guys. Welcome to a very special edition of the Full 100. I have a special guest today, Dr. Anie. Will be joining us today to discuss our most worrying questions. Dr. Anie is also somebody who's had the vaccine herself. So again, we'll be talking to someone who's actually experienced the vaccine. She's had both her doses. So guys, without further ado, let's get down to today's show. Thank you so much for joining us on the Full 100 today. I'm going to let you introduce yourself, but listen, I just want to say this. We really appreciate that you taking your busy time out as a busy doctor today with what we've got going on to join us today to help us answer some questions relatively more directed at the Black community and the false information, the disinformation going around today in the Black community. So thank you so much for joining us. Just introduce yourself so the guys know who you are.
You're welcome. Thank you for having me. So my name is Dr. AYELABOLA. So I'm a GP working in Walthamstow. I've been qualified as a doctor since 2009, GP for nearly 7 years. And the areas that I've worked is usually in diverse communities, the Walthamstow, Leytonstone, places like that. So I'm happy to be here.
Thank you so much, and it's really appreciated. I want to go straight to the point, Doctor. I'm quite excited about. I found out after we spoke that you've actually had your first and second vaccine shots, correct?
That's right, yeah.
Brilliant. How long ago did you have that?
So I had both. So I had the first one at about the beginning of January, and then I had the second one 3 weeks after. So I was quite fortunate that I was able to have both jabs before the government guidelines came in to delay the second jab. Yeah.
Yeah, because now people are not having on 3 weeks. They're having it basically up to 12. It could be up to 12 weeks, right?
That's right. Yeah, up to 12 weeks after the first one. Yeah.
So tell us what you found. You're the first person most Black people who watch my channel are gonna hear from who's actually had the vaccine. Not seen on TV, not in the newspapers, but live. So please tell us your experience with the vaccine so far.
So my experience was fine. So essentially, I was called. I had to go to a special place to have the vaccine. You go in, they take your name, they take your details, they check your temperature before you go in to make sure that you're well. And then you sit down with a nurse, with two nurses. One explains what the vaccine is. They check your suitability. So they ask, for a woman, are you pregnant? Have you ever had any allergic reactions to any vaccinations? They ask you, are you feeling well at the moment? And so once you've gone through all those questions and it's fine, then they talk you through what's going to happen. So they give you the vaccination, usually in your non-dominant arm. So I'm right-handed, so they did it in my left arm just here.
Right.
And it's quick. It's like if you've had a vaccination, if you're going on holiday, or if
that's what I keep saying to people. I've had those. We've all had them. We've all had them. For some reason, people have forgotten that we do have to vaccinate sometimes to travel.
Yeah.
You know?
Yeah.
But what about the after effects? What did you feel on day 1, day 2, day 3, week 1?
On the day, I felt fine. So I had mine around 5 o'clock in the afternoon. Right. So by the next morning, where I had the injection was a bit sore if you pressed it. And then towards the day, the whole arm felt heavy.
Okay.
But then by the second day, it was fine. I didn't have a fever. I didn't have any aches and pains. I know some other doctors I know have had, maybe felt a bit achy, but they've had similar reactions when they've had other vaccinations, and they only lasted for a few days and they were fine. So I don't know anyone that has become unwell or needed to be hospitalized or anything like that from the vaccine.
Wow, that's brilliant. Which one did you have? Was it the AstraZeneca or PFIZER?
So I had PFIZER because that was the first one that was approved in the UK. And they had placed orders for that. The UK had placed orders for that. So that was what was available first. So that's why I had that.
Wow. That's brilliant. That's brilliant. I want to, before we go into, as you know, I listed a list of 7 questions.
Yeah.
Which, in my opinion, those 7 questions cover what we all hear out there. Yeah. Let me go to the questions now, because this is the main reason why we invited you on this. So thanks for sharing your experience and your knowledge and that. So if we start with, like, I put on there 7 questions because this is the same arguments I keep hearing over and over again from our communities and that. The first one is the most important one, I guess, is how did they make the vaccine so quickly? Before you answer that,
yep,
I'm going to tell you what I've been telling people. Tell me if I'm correct.
okay.
Right?
Okay.
So I'm not a doctor, but I
Right.
try to break it down for normal folk to get it. So
Sure.
this is what I say to them. I'll say to them, look, it's like back in the day, we used to have a way of making vaccines, which is like, if you compare it to making mashed potatoes, it's like buying the potatoes from the shop, peeling them, boiling it, and then mashing it. Whereas over a couple of decades now, they've been trying to invent a whole new way of making vaccines faster, so that it can, so that when even with the flu vaccine there's a variant that keeps mutating every couple of years, so that it's easier to catch up with these. So what they do now is, in the potato comparison, it's like powdered mash, having the powdered mash ready, and all you got to do is add the hot water and you got mashed potato. Yes. Is that a good comparison?
So it's pretty good. It's pretty good in that, yes, the process has been shortened. So I've had other analogies of car production. Back in the day, you know, they had lines of people making cars, and now you have huge machines that do most of the work. Yes. So the whole process is automated and very fast and very efficient. So that's similar thing to what's happening now with the vaccines.
So that's basically how they managed to make it quicker, right?
Yeah. When you sent me the question, so that I tried to break it down into the four main aspects. Okay. And the most important aspect, and I think what people are worried about, is the safety aspect. So people automatically think if you do something faster, you may be doing it in a rush, and it's not so safe. Yes. But that's 100% not the case. So the safety aspect cannot be sped up, cannot be, you can't cut corners, because there are international bodies. It is their job to make sure that any medication or vaccine that is to be given to humans has to pass rigorous steps, and you can't bypass that. So that stays the same. But things that you can improve on, for example, is the manufacturing. So there are processes now where they're automated. We have gene sequencing, so you can actually make things much faster than how we used to before. Yes. And so that's one aspect. The other aspect is that, so when you make a vaccine, you go through 3 phases. You go phase 1, phase 2, phase 3. And normally you do one after the other, and then you get to the end. Then you say, this is the vaccine. Now we need someone to fund us so we can make lots of it and then give it. But with COVID-19, lots of people are already interested. So right from the beginning, you had the safety agencies looking at the data as it became available. So they didn't wait till the end. Yes. This trial was done. They looked at it. Is it safe? Okay. And so they did things in parallel. Yes. And then you had manufacturing companies who from the beginning were already thinking, how are we going to mass produce? Whenever they get to their point of safety, how are we going to mass produce? So you're already thinking ahead. Yes. So they already made the process, just waiting for the final product.
For the phase 3 trials to be right.
And then they slot it straight in. So that's how it's one of the main things. The other thing is the actual, so COVID-19 is the disease, but the virus name is SARS-CoV-2. Yes. Which is a family of coronaviruses. So coronaviruses are not new. Scientists have been studying them for 50 years. The common cold is caused by 4 types of coronaviruses. So we know about them. Yeah. So they already had a head start. So they weren't starting from scratch. Once they knew this was a coronavirus, it's like, okay, we'll just look at
that's key. That's key for people to understand.
Exactly. It's not new in that it's an unknown virus.
Right. That's what a lot of people don't get. A lot of people just think the virus came on. Look how long we've had cancer. We've never been able to cure cancer. And I say to them, there's loads of different types of cancer. You cannot produce one vaccine for all cancer. Exactly. So the cancer is totally different. It shouldn't even be in the conversation. But our communities throw these in the conversation all the time. And what I find disturbing is they seem to ask the question. They don't want an answer for it. Have you found that?
Yeah, with some people, I think the problem is that they ask the question, but they feel they already know the answer. So, right. so it might be that, the willingness to listen to an alternative is not there. But I think the way we can overcome that is by continuing to give the message out there and to say, listen to the alternative, look at the data, and let's have a discussion based on that.
Yeah, and I just want to say this because everyone who's watched my channel, they know I'm not here pushing people to take the vaccine. And I had a conversation with you yesterday, and we agreed on that, didn't we?
Yeah, definitely.
What we're trying to do is to give people the correct information,
Exactly.
and then you can know whether you want to do a left turn at this road or a right turn at that road.
Exactly.
Because if you don't know where you're going, then how do you know which way to turn? Exactly. And that's what we are trying to do here. We're not trying to get anybody to go take the vaccine. It's a choice. I respect people's choices, and we had that conversation yesterday as well. But many people are making their decision based on false information. And that's the killer in this situation. And that's why you and I are here today talking. I'm going to move to the second one now, which is, how do we know what side effects there might be in the short term or the long term? Well, you're an example of the short term so far. So
so far
we can say, well, how many weeks ago did you have it now?
So that was at 6th of January.
6th of January. So about 6 weeks nearly now, or 5 6 weeks. We can delete the first 5 weeks because we got a living example of what happens after 5 weeks.
Exactly. So I think short term, as you said, I've had it. I know many people who've had it and have been fine. Lots of my patients have had it, it's been fine. And actually, all the trials, phase 1 of a trial is to look at the short term effects of the medication. So they've done all this before. So we're not the first people to try it. They have gone through all this. This started in January 2020, phase 1, phase 2, phase 3. So the short term, we know, and that's how we can say, like, you might get a sore arm, you might feel a bit, because these are the known short-term side effects.
Yes.
Being come about in the studies.
Yeah.
In terms of long-term effects, now with all new medications, it's the same issue. All the medications that we take now, paracetamol, ibuprofen, they all started in this process.
Yes.
And then it's only over time that we've seen the full effects of things. But as I said, this trial started in January 2020. So all the people that were in those trials, they're still being followed up to now. So we're a year down the line. So we can say that from then to now, there has been no serious or no long-term effects in these people, and they'll be followed up for a minimum of 2 years. So that's how we know in terms of long-term safety up until just over a year that it's there.
So the data we have right now is at 1 year.
Exactly.
That's what we have.
1 year in terms of
so far, so good. Yeah.
Exactly.
Brilliant. I'm going to go over to question 3 now. Now, a lot of people say this because they've been on the government website and all of that stuff. And our government does not help because, it's so jumbled, the messaging. So that leads to my third question, which is, why take it if they're still saying it won't stop you from catching the virus, or if it won't stop you from spreading it to others anyway? So why take it?
So the answer to that is we don't know. That is the honest answer. So as we've said, we're looking at things starting in January 2020, but you will only have that information once you put it in the general population. I've only just started. So the theory is that it may do, but we don't know. And so it's better to err on the side of caution and vaccinate the population as if it may not. And then over time you will see that actually it did. But because this is such a serious disease, it's better to err on the side of caution on that part. And so that's sort of the quick answer. This is we vaccinate if you're going to go to a tropical country and you vaccinate yourself, because you don't know how, if you get that that infection, how it's going to affect you. So we're always doing things with an evidence of caution, and it's the same with this.
Thanks so much for that. Right now, the fourth question is funny about this, because you and I spoke. I sent you these questions. And then you went and your husband told me you went and done some research on the fertility side, because the next question, I just told the viewers, the next question is, what do we know about fertility for women? Now, we discussed it briefly because you were doing some research on that for this show. And then last evening, I'm watching the news, and lo and behold, they are now starting trials in 20,000 or 2,000 women. In the US, all pregnant women. Some pregnant women have had it anyway, but not enough of a trial. So they're now actually starting trials on that. So before we discuss that, I'm just going to air a video. I'm just going to air that clip for the viewers to have a look. Yeah. So guys, just take a look at this clip and we'll see you on the other side.
And Sanjay, Pfizer just announced they've administered first vaccine doses to pregnant women as part of a global trial. Tell us more about that. What do they hope to learn?
So this is the first actual trial now. You remember in the original trials, pregnant women were not part of those trials. There were women who became pregnant during the trial. And then since the vaccine has been released, there are women who are pregnant who said, I know there's no data, but I'd still like to go ahead and get the vaccine. And about 20,000 women have done that. And there hasn't been really any significant side effects. But now you want an actual trial. They're going to look for safety. They're going to look for efficacy, meaning are pregnant women generating the same antibody response. But they're also going to look at the fetus and baby and follow the baby 6 months afterwards for safety, but also to see, do antibodies then go to baby and provide protection for baby after pregnancy?
Interesting. Dr. Sanjay Gupta.
Guys, so welcome back. You saw the clip, and so doctor, what did you think of that?
I thought it was very interesting. I think what struck me was that what that clip showed is what has happened before. Like a lot of the processes that are happening, it's new to us, but it's not new to science.
Yes.
So there are medications that are licensed in pregnant women that are trialed on pregnant women, but most people don't know. They just see the end product. But we're seeing live what's happening, and so I think in terms of the trials on pregnant women, it shows people how things work in terms of scientific research and safety. And I think it's amazing. I always find people who volunteer for these trials amazing, because
I'm telling you,
they really are amazing.
Listen, I featured a couple of videos back, I think it was. I featured the trial that they're starting now on 6-year-olds to 15-year-olds.
Yeah.
And I featured a young man called Caleb, a 12-year-old, and his father on the show. And I'll tell you what, we have to take our hats off to people like them.
Yeah.
Because personally, I don't think I put my child up in something like this. Not just the corona or vaccines, just any trial. It will be really difficult for me to look my child in the face, and I'll feel like I'm sending them into the lion's den without no protection, without protecting them. So we have to take our hats off to these people. These pregnant women who are going through this trial, let's remember, every one of them is carrying a precious person inside of them. And yet they're willing to go through this. That's massive.
It is. And actually it reminds us that all the medicines that we take today, somebody had to be the first.
Exactly.
The benefits that we have now, somebody had to be the first.
Exactly.
So yeah, it just goes to show the importance of everybody doing their part to help
for humanity.
Yeah.
For humanity.
For humanity. Others did it before, so we can be where we are now. And I think it's our responsibility to do it now, so that for our people going forward, our local community, the world as a whole, it's all part of it.
Really good, that is. And I really hope those trials come good, because obviously I put that question in there because that's a genuine question for, let's say you're my age, a 50-something-year-old person, you got a 30-year-old daughter, I've got a 30-year-old daughter. You know what I mean? I want to be able, I don't want to say to her, no, the vaccine, and then I'll see that it has something to do with her fertility later on. So that's a huge question. And thank you for dealing with that for us. The fifth question now is, would we need to keep taking this every year, like the flu vaccine, for example?
It's possible. It's possible. The reason that is because we've seen that the virus does mutate and produce variants. Most viruses mutate. That's the way that they behave. The one that we know the most is the influenza virus. That's why you tend to have a flu vaccine every year. So this is not unusual. But it's likely that we may need to have vaccines every year. But again, the technology is evolving. So the specifically the ones that use genomic sequencing, because it's an automated system. It's like you put the information into the machine, it generates it, and so it can be quite rapid. In terms of getting the vaccine. So it's up in the air. It's possible, and I think maybe if people have that as an idea, if you look at it like how we do with the flu vaccine,
that's exactly what I've said to people. It will be if we had to have a booster every year, it will be the same as the flu. It's no different to the flu. Exactly. So it's a possibility, basically.
It's a possibility.
Okay, brilliant. Thank you for that. And the second to last question for myself is is there any one vaccine to recommend? Is there one better than the rest in your own opinion, in your expert opinion? Before you answer that, I'm trying to go for the Oxford AstraZeneca.
Right.
And I'll tell you what sold me on that is because it's not just a pharmaceutical company.
Yeah.
It's a pharmaceutical company and a reputable university combined together. I think that's what sold me on it, because all the others are all pharmaceutical companies on their own. What do you think?
Okay, well, if I look at it from a purely science base and evidence base, then so the Pfizer, Oxford AstraZeneca and Moderna, they're all as good as each other. Okay.
Right.
So if we think about what the aim is to have a vaccine that will significantly reduce the risk of serious disease or death. That is the end point, and they all do that.
Okay.
And they're licensed from the age of 16 upwards. So they're all as good as each other.
Brilliant. And the last one I have for you, and this is one that probably led me to reach out to yourselves, which is, what is the doctor's opinion? What's your opinion on her fellow doctors, or your fellow doctors, making a career out of spreading disinformation about this? How do you feel when you see a doctor like yourself who put in so many years to qualify as a doctor to save lives, and now what I call pay-as-you-go doctors who would take money from anybody to say whatever it is?
Yeah. How
do you feel when you see that as a professional yourself?
It's hard to see, because my own experience is that you go into medicine, you go into the profession to help people, to look at the facts and try to arrange it in a way that allow people to make a decision about their health.
Yeah.
And it's like you're a translator. This is the science. I'm going to explain it to you so that you can understand, and then you can make a decision about what you do with your health.
Yeah.
So when anybody in the medical profession, or anyone else, especially the medical profession, I guess, who misconstrues that or doesn't allow that process to happen, it is worrying, and it's saddening as well, because especially for the Black community, we really need advocates to speak on our behalf, so that we don't inadvertently disadvantage ourselves from receiving the healthcare that we need. We know that this historically. There has been disadvantage regarding health, social care with Black and other ethnic minorities. And I understand people's caution, but I think we also need to make sure that we don't have a hand in that as well. We need to make sure that we look at the information, look at the data, and make an informed decision.
That's right. It's pretty shocking what I've found. I mean, I've found in my doing this that they really there are two communities. I didn't realize did you know this, by the way? Did you know that the Orthodox Jewish community have a thing about vaccine just like the Black community does? Did you know that?
No, I wasn't familiar with that. No.
I only found that out in the last 2 weeks during my shows, 2.5, maybe 3 weeks, that not the Jewish community as a whole, but the Orthodox Jews, they have a thing about vaccines similar to, on the same scale, near enough, like Black community does. Obviously, as is historical, that comes from somewhere. I'm not sure where that comes from. I think theirs might be religious, I think. But what I'm finding is that these pay-as-you-go doctors and nurses are really targeting those two communities. They're targeting the communities that are already scared of stuff like this. And I'm seeing the end result is going to be a suppression of uptake in these two communities. Now, when you look behind the entities who are carrying out these attacks on these communities, many of them are not good people. Many of them are right-wing, running with extremist type of people. What do you think about that?
I mean, I don't have sort of personal or information or I suppose experience on that, but I think that as a community, we need to make sure that we are careful of what we allow to influence our decisions.
100%.
And make sure that it's all not one-sided, because you need to make sure that your decision you're making is based on real evidence, real facts. So that's really what we have. Anecdotes, and I heard this and I heard that, that shouldn't be what leads us as a community.
Well, it's happening.
Yeah.
Sadly, it's happening, and I'm really worried for my community. I really am. Right, so that's the you've got one. That's the last of the questions. Again, thank you so much so far. You had one other thing you wanted to touch on, which I missed in my questions, and that was with the DNA, about changing DNA.
Yeah, that's right. So one of the things that I've heard that's been circulating around is that the vaccine will change your DNA in some way, shape, or form, and that's why you shouldn't have it. And actually, it's completely not true. And I was thinking, how can I explain it in a way that isn't too like sciencey, but makes it clear? So I'm going to try and do that, if you bear with me.
Okay, no problem.
And so just see how I can explain it. So essentially, all human beings are made up of cells. So a cell is like a blob with a command center in the middle, which we call like our nucleus. So that's what holds the DNA, our information. Right. So the Pfizer vaccine has got what we call mRNA.
Yes.
So that may be what people confuse with DNA. We have DNA within us, and this is mRNA. They're not the same thing.
Yes.
So the mRNA, M stands for messenger. So if you think about the way it works is you get your vaccination, it gets jabbed into your arm, it goes through the muscle into the blood. This messenger mRNA finds a cell and goes inside it. When it goes inside, it's got a message, it's like an instruction that tells the cell to make this little protein. And this little protein is like a flag, and it comes out of the cell and it waves. And this tells our immune system that this is an abnormal thing. It's not normally here. Let's go and make some antibodies to try and get rid of it. Yeah. And the antibodies is the memory. So all vaccinations, the aim is to try to get our bodies to make antibodies so that when we see the real thing, our body's already primed, they know what to do. So they deal with it straight away and you hardly get sick. That's the idea.
Wow.
So nowhere in that process is our DNA being manipulated, because our DNA is in the control center right in the middle called the nucleus, and that's protected by an envelope. And it's protected by an envelope because it's precious and nothing can go inside that. So this whole thing about changing your DNA, the messenger RNA does not go inside and change our DNA. It doesn't happen. Biologically, it doesn't happen. So there's no way it doesn't happen. Our DNA is not changed.
You have put it so much better than I could have even dreamed of putting it. that goes straight to the heart of it. That is a fabulous way you just described it. You've even enlightened me a little bit. As much as I've been on the computer and paying attention to everything, that answer has actually enlightened me, and you've given me a tool now. Whenever if I have to have a conversation with someone else, I'm able to relay that to them. That is fabulous. Thank you so much for that.
You're welcome.
Right, listen, we've come to the end of the questions. However, there's one last video I want to show my viewers, which is a video that, again, I recorded yesterday. And this deals with, I think I sent you that this morning, right? And you've had a look at it. This is basically discussing life expectancy in America. Shocking, the revelation. So let me just air the video. Let me not tell them what it is. Let the guys have a look at the video, and then we'll come back and finish off. Yeah? All right, so guys, take a look at this real quick, and I will see you on the other side to say our goodbyes.
In our health lead today, the life expectancy in the U.S. dropped a full year in the first half of 2020, according to new data from the Centers for Disease Control. U.S. life expectancy now at 77.8 years. That's the lowest it's been since 2006. Experts say this decline has much to do with the ongoing pandemic. CNN's chief medical correspondent, Dr. Sanjay Gupta, joins us now. Sanjay, how big a deal is this drop of a year in life expectancy in the U.S.?
I mean, it's a huge deal, Jake. This is one of the things that we measure the progress and sort of how well we did as a society from a healthcare standpoint, and we're going in the wrong direction. I mean, almost since we started really measuring life expectancy regularly, the numbers have been going up, certainly in the developed world. We have to see, is this a trend now, or does it go back up, in a few years from now?
And this report also found, even more troublingly, that life expectancy for Black Americans dropped 2.7 years. Why?
Right. Yeah, I mean, well, it's the same, the same disparities that we've been talking about. All the things that have led to life expectancy dropping overall in our society have been amplified in Black and brown Americans. So you're right, 2.7 years for African Americans. Life expectancy has dropped nearly 2 years now for Hispanics.
Right, welcome back, guys. Doctor, I'm pretty shocked that in 12 months, this situation has wiped off 1 whole year of life expectancy of white people. Yeah. 2.7 years of Black people. That's nearly 3 years.
Yep.
And 1.9 years of Hispanics. Are you shocked at that statistic?
I am shocked. It's really shocking. And what's shocking is the length of time that it's taken for that to happen.
Yeah,
Such a short amount of time, and that's almost unheard of outside of something else like wars or
like a war or
exactly
famine or war and them sort of things. And they usually go on for lots of years before you even see that.
Exactly. And that just shows, I hope it shows people how important it is that we deal with this quickly and take it seriously, because it is happening right in front of our eyes and it's affecting everybody, life expectancy in Americans, and it's a huge thing. And if you look at the uptake of vaccination program in America, how they've dealt with it, certainly not in the best way, and it's reflecting the life expectancy.
That's right. Do you expect to see a similar life expectancy results here when it's published?
I don't think it's going to be as drastic as America, because I think on whole our vaccination program is moved on further than theirs.
Yeah, it's the best in Europe, to be fair.
100%. And so I don't think it's going to be as drastic, but I think if we as a community don't listen and take this on board, we may have similar trends. Yeah.
Wow. Doctor, I can't thank you enough for today. Really, I pride myself in having kept informed from the very start. I've made it I've made it a duty to inform my audience as well from the very start. From Moderna was the first vaccine that started trials. I've been keeping everyone abreast of it. Even the Sputnik V, the Russians, I kept people informed on that. So my channel's just been about, here's the information, guys, do what you want with it, but here's the real facts. And you have played a massive, massive role in that for me today. So thank you so much, Dr. Anie.
You're welcome. Thank you for having me.
Not a problem. Is there anything you want to say to the viewers before you go?
I just think that it's important, as we've had a discussion, that you arm yourselves with the right information. I'm here speaking as a Black woman, as a doctor, as a mother, as a wife, as a daughter, that this is our community, and it's really important that we take charge of it and make sure that we look after ourselves, our families, and the community as a whole. Brilliant.
Thanks ever so much. When you're back in work, you're off today as well, right?
Yeah, I'm off today, half term, so I'm back to work on Monday.
On Monday, brilliant. Enjoy your weekends.
Thank you.
Enjoy the kids. All right. Thanks so much, and say hello to the good husband as well.
I will do.
We'll speak real soon. Take care. Thank you so much.
Bye
bye now. Thanks a lot for joining us on this very special show. I hope the show's been very informative. I know it has been informative to myself, even though I've been on it from the very start. I learned a lot from speaking to Dr. Anie. Guys, if you like what we do, please hit the subscribe button. Don't watch this without hitting subscribe and supporting what we do. And share this video, because people need answers. And we're not sharing the good stuff enough. We're sharing so much more of the bad stuff. So guys, please hit the subscribe button, and I'll see you all on Monday. Have a fabulous weekend. Bye-bye now.